What I would really want those providers of care to know about care availability is the directness of the link that is being created with inpatient case managers. Case management is a very relational sort of work, the relationships that we have with our patients and our families, and then with those settings that patients go to for post-acute care. And one of the challenges, particularly with adult family homes, is there's so many of them that we really don't have the opportunity to build those relationships. And this is really a bridge to those relationships with all post-acute providers, and really appreciate care availability helping make that happen for all of us. I see the time savings as potentially huge in trying to find a correct setting for a patient through care availability versus these email blasts that are kind of the current process. I would like to say that it could potentially be weeks even. Not weeks of the care manager's time, but weeks of time where a patient is in a hospital bed because we're not able to find the correct placement for them. That's where I really see a true advantage for the hospital system.
Out in the community. So since care availability has become available to us, we utilize that regularly throughout our day. And it's so handy to be able to, in the moment, know exactly what facility to contact, or most importantly, to provide to the patients and families, and not wasting the patient family's time nor the case management's time who's trying to locate a certain level of care. So, especially during this time in which we're unable to do a lot of in-person visits, both in the hospital as well as out in the communities, this offers them a resource that they can go online and view the facilities virtually, especially if they have information on care availability, photos, and those sorts of things, that they can visualize the facility and so forth, because they can't always go in person and make visits like they were doing before. So that's one of the most elusive groups for us. Locating a list of the homes is very, very challenging for case managers. First of all, finding out, oftentimes we would find that there's an adult foster home we didn't even know about, because there has never been a location that we could go to before that would give us a true in-the-moment list. Our patients and families would very much appreciate having an option to go to their location versus having to go to a different level of care that oftentimes they don't want to go to that level of care. But we, as the inpatient team setting up that care plan, have no ability at this time to uncover the availability of those homes in our community.
Yeah. I mean, one of the things is patients not going to the correct level of care, where there is an opportunity for a patient and an assessment of that a patient would be best served by being in an adult family home setting, that is really ultimately where they will be most likely to thrive. Our goal is always to get patients placed in a setting where they will be safe and not need to return to the hospital. And one of the things that we see intermittently is a patient needing to go to an alternative to what we assess is the ideal. So if the adult family home is the ideal, but we can't find that correct setting, It may be an RCF or ICF. I've even seen patients remain in the hospital until they were able to return home. And home is the discharge option, not because that's what we think is the best case scenario, but just because we've not been able to find any other alternative.